In the last video, we had seen about assessment of airway and breathing, also oxygen delivery requirements. Now let us see about when immediate need for assisted ventilation is required. As we have heard about the term ventilators, these ventilators helps a patient to breathe by assisting the lungs to inhale and exhale the air. There are two main types of mechanical ventilators, which includes positive pressure ventilator, where air is pushed into the lungs through the airway, and we have negative pressure ventilator, where air is usually sucked into the lungs by stimulating the movement of the chest. So here let us see in what situation we should prefer this assisted ventilation. Usually we will be supplying oxygen initially by face mask. Suppose if it fails to maintain the partial pressure of respiratory gases, so then it is essential for us to go with the assisted ventilation. So this efficacy of ventilation can be gauged by measuring the blood gases. Suppose the retention of carbon dioxide will be measured in terms of partial pressure of carbon dioxide. If it is more than 45 mmHg or 6 kilopascal, or in second condition by considering oxygen, hypoxia, where partial pressure of oxygen, if it is less than 70 mmHg or 9.3 kilopascal, in spite of giving oxygen by face mask, it is a strong indicator for requirement of this assisted ventilators. Even some of the drugs can cause disturbance in this respiratory systems. So here we have a list of substances which are known to cause respiratory depression, and even some of the drugs, they can stimulate the respiratory centers, and even we have some class of drugs, they are associated with some non-cardiogenic pulmonary edema status. Let us see some example of these agents which can cause respiratory depression. So here is a table of agents which can cause toxic respiratory depression. Here we have a list of drugs which can cause respiratory failure by acting on the center, failure of respiratory centers. Example includes antidepressants, antipsychotics, ethanol, opiates and sedatives. They are the example of agents which can cause respiratory depression. Then even other possibility of failure of respiratory muscle can also cause respiratory suppression. The agents include neuromuscular blocking agents, nicotine, organophosphates, shellfish poisoning, or even snake bite. Cobra poisoning causes respiratory depression by causing paralysis of the respiratory muscles. Let us enlist some of the agents which can cause stimulation of the respiratory system. As we know, the general principle of drug action, which says like initially any substance, if it shown stimulation, so usually in higher dose, so they causes depression of the same system. All the stimulation effect may end with the depression. Similarly, these agents initially they can cause stimulation of the respiratory centers, but in higher doses, so they end up with the depression of respiratory system. So these agents which can cause stimulation includes amphetamines, atropine, cocaine and salicylates. They can show dose dependent responses. And here we have agents which can cause non-cardiogenic pulmonary edemas like amphetamine, anticoagulants, aspirated oil or talc, beta blockers, calcium channel blockers, carbon monoxide, cocaine, cytotoxic and immunosuppressive drugs, or some irritated gases We have some NSAIDs, opiates, then even oxygen toxicity also. That's why we should measure the partial pressure. Then radiation, salicylates, sulfonamides, thiazide diuretics, and tricyclic antidepressants. So these agent causes non-cardiogenic pulmonary edema, which will be characterized by hypoxemia. This hypoxemia is a condition where oxygen level will be very much less than the normal. Even some of the respiratory conditions may be get exacerbated by some of the drug. These are the drugs which can exacerbate asthma condition in a patient. So these are the drugs which are contraindicated in asthma, like non-steroidal anti-inflammatory agents. Some of the antibiotics includes penicillin, cephalosporins, tetracycline, and nitrofurantoin, which can exacerbate the asthma. So then cholinergic drugs and chemotherapeutic drugs can exacerbate asthma condition. Let us move on to the next stabilization aspects, as the stabilization can be focused with ABCD: airway, breathing, circulatory failure, and depression of the central nervous system. Already we addressed with airway as well as breathing. Let us see about the circulation, circulatory failure. So many of the drugs, they causes changes in pulse rate and blood pressure. Even many of the drugs in higher doses, they can cause cardiac arrhythmia and heart block. Let us categorize that drug. So this is the table which represents the drug causing disturbances in pulse rate and blood pressure. So here it is concerned with heart rate and pressure, blood pressure. Here two categories we can observe, where we can observe rise in the heart rate and decrease in the heart rate, tachycardia and bradycardia respectively. Then coming with the blood pressure, hypertension and hypotension. Let us see the drug as an example. Tachycardia and normotension. So rise in the heart rate, then the normal can be observed, where blood pressure won't be altered. Examples are antihistamines, caffeine, cannabis, lomotil, thyroxine. The next category, tachycardia can be observed, and here the difference hypotension can be noticed. Carbon monoxide, cyanide, phenothiazines, and theophylline. The next group, you can observe rise in the heart rate and hypertension. Examples are amphetamines, cocaine, phencyclidine, phenylpropylamine. Next category of agents causes decrease in the heart rate than the normal, then also causes hypotension, which include clonidine, levodopa, MAO-I, organophosphates, opiates, tricyclic antidepressants. Some drugs causes bradycardia and hypertension. Example is phenylpropanolamine. Even some drugs in higher dose, they can cause arrhythmias. Let us see which are the drugs and toxin induces arrhythmias. Like we have sinus bradycardia or AV blockage can be observed with administration of alpha-adrenergic drugs. Even beta blockers in higher dose, carbamates, cardiac glycosides, organophosphates, and cyclic antidepressants. So many of the therapeutical agents in a higher doses, they can cause this AV blockage. Then even some drugs, higher dose causes sinus tachycardia, which includes amphetamine, anticholinergics, antihistaminics, carbon monoxide, cocaine, phencyclidine, phenothiazines, thiophyllenes, cyclic antidepressants. Even for practice purpose and even for examination purpose, it is essential for you people to learn the drug names which can cause disturbances in the circulation. With this example, it will be very much easier to understand the concepts, like how a drug can disturb the circulatory responses. So in the next video, I will be talking about the depression of the central nervous system. Till that, just go through the material which is uploaded along with the video. So where the general management principle in detail it is mentioned. We can focus on the stabilization aspect, which is the first step involved in the general management of poisoning. So in the previous video, I have covered about the assessment technique. People can go through in the material, and also we can check about the circulatory aspects. So here just an introduction by taking various example of the agents which can cause the depression of the circulatory system, and in the future coming video we will be talking about the depression of central nervous system, and we will take individual aspects of depression of various system. Today what we discussed about cardiac failure or cardiac arrhythmias, how it can be treated. What the knowledge we have gained in pharmacology in the management of various diseases and pharmacotherapy, so that can be utilized here to manage the situation. Time being, we can go through the drug classification which are used in the management of hypertension and also cardiac arrhythmias and other cardiovascular complications. That information will help you to utilize in the management of cardiovascular complication. Thank you.